Good evening and thank you for joining us. Tonight, as YRMC prepares for a federal response team to arrive and assist medical staff, our News 11 team continues our inside look at the hospital's COVID-19 unit and what nurses are going through on a daily basis. Our reporter Cody Lee brings us more of his two-part exclusive you'll only see on News 11.
Yes, yesterday we introduced you to a charge nurse who took us inside one of YRMC's special COVID-19 units where over 50 patients are currently being treated for the virus. The person at the helm of it all sat down with me to discuss how she and a fleet of nurses are dealing with yet another wave of COVID hospitalizations. When you step inside, it's a somber moment, knowing so many people have fallen ill to COVID-19.
It's hard to see the pattern when you look. So young, old, now we're going, okay, we thought we had a hold on it, so it's evolving and changing.
Kim Miller is the new director of the COVID unit I toured. She's also a familiar face to News 11 after we interviewed her a year ago when she was just a nurse.
I was encouraged to apply, and there's not a day that goes by that I regret that I applied, and to lead this team they are definitely a unique group of people that step up to take care of our patients in our community every day.
Miller says the hospital has staff to treat the current increase in patients, but each nurse is attending to at least 5 patients each shift. But this devastating new normal is not something everyone can handle. Amanda Sharpenstein explains how this job could really take a toll on your mental health.
Those horrible phone calls that you're calling and saying that they've lost their loved one, or if they're lucky enough to be here, the cry you hear that a child lost their mother or their mother lost their son.
Some nurses are leaving the business altogether.
Unfortunately, in the meantime, we've lost a lot of nurses that mentally have broken and they can't mentally do this anymore. They love taking care of people, but that's just the sheer amount of loss and suffering that you see.
YRMC is on the verge of receiving much-needed assistance, which Miller says will ease some of the workload for her team.
The federal team sometimes will bring CNAs, or it doesn't always have to be a bedside nurse because you do a team nursing model. We work together as a team and we use those ancillary staffs to the best of their ability and within their scope.
And along with the 10 paramedics expected to arrive any time now, YRMC will also be receiving up to 14 nurses. They should be here within 2 weeks. Reporting in Yuma, Cody Lee, News 11. Back to you.
Cody, thank you for that report. Our thoughts definitely with the frontline staff who have been dealing with this pandemic. I can't imagine what they've been going through. So again, our thanks to them.